Hi, I am Dr. Pradeep Kumar N. I am a consultant plastic surgeon in Bangalore. Once you are considered facial palsy reconstruction, these surgeries are mostly done under general anesthesia. If we think of nerve repairs, we usually give a hidden preauricular incision, where after recovery also these incisions are not that evident. We try to open the nerve, we see if the nerve ends are together, whether we can join those nerves. If not able to join, we try to take nerves from different parts, like nerve to masseter muscle, which is a different nerve where we can connect to facial nerve to improve the function, or a hypoglossal nerve where we split the hypoglossal nerve and connect to the facial nerve to make the functional improve. So it's mostly under general anesthesia, about 2 to 3 hours surgery, and once you recover, there will be stitches all along the preauricular area, which will be removed after 7 days with small scar removing creams and other things. Most of the scars can be removed. With time, with physiotherapy, facial movement starts coming back.